Hello friends, welcome to youtube.com oblique Dr. Vijana. I am Dr. P.R. Patel, Professor and Head Veterinary Medicine. We'll discuss here important bacterial disease malignant edema. In part 2, we'll discuss various important predisposing factors and pathogenesis of malignant edema. For more videos on disease aspects in veterinary medicine, please visit youtube.com oblique Dr. Vijana. Predisposing factors for the malignant edema. Clinician gives intravascular injection of drugs and sometimes perivascular leakage of drugs. Also causes malignant edema. Intramuscular injections of drug for the treatment also causes malignant edema. That is common in horse for the treatment of colic. Some drugs have more tendency to cause muscle necrosis because of their irritant nature. There is anaerobic condition, proliferation of Clostridia and malignant edema. Such drugs are anthelmintic and nutritional supplements. They are irritant. Lack of right aseptic technique during injection also causes entry of organism into the muscles and malignant edema. Malignant edema generally occur sporadic. Sometimes outbreaks are observed in sheep, that is due to subsequent management practices of more animals, such as wound caused by shearing, docking, lambing, parturition in cattle, injury to vulva. They also cause malignant edema. Dipping of sheep immediately after shearing cause contamination of dipping fluid, and that results high incidence of malignant edema in the other sheep because there is presence of wounds in the other sheep also, and there is outbreak of the malignant edema. Condition observed by the clinician in rams: swelled head. This occurs in a young ram of 6 months to 2 years of age. The ram run in a group and they have a nature of fighting among themselves, and during fighting they cause the wound on head because they fight head to head, and this wound, if get the infection by Clostridia, produce edema of the head. That is one form of the malignant edema. Friends, we discuss here important aspect of pathogenesis of malignant edema. Clostridium septicum is a common inhabitant of the soil and intestinal content of the animals. So infection is present in the environment, and this infection occurs through the contamination of the wound. It is observed by the clinician that horses and cows have a dormant spores present in the muscle tissue. When there is injury to the muscle, anaerobic condition causes malignant edema. The wound is caused on animals in number of ways: wound due to accident, wound during shearing, during castration, docking, lack of aseptic precaution during injection, unhygienic condition during vaccination, wound to vagina and vulva during lambing in sheep, wound during parturition to vagina and vulva in cattle, intramuscular injections in horses, perivascular leakage of drugs, fightings, and there are many other ways that causes wound on the animals. Wound causes malignant edema, but all wounds are not responsible for malignant edema. Deep wound, where there is local anaerobic condition that is required for the proliferation of Clostridia organism, that causes malignant edema. And when there is multiplication of organism, they produced potent clostridial necrotoxins, local lesions. Necrotoxins by its nature causes necrosis of the tissue, and two toxins are produced, alpha toxin and beta toxins. They are responsible for pathogenesis of the disease. Necrotoxin is produced in the local lesions, and these toxins produce local signs of necrosis, and when these toxins are absorbed into the circulation, they produce systemic signs of the toxemia. The important virulent factors that helps the organism to causing the pathogenesis are hyaluronidase and collagenase enzymes. This virulence factor causes destruction of the tissue, necrosis, and help the organism to spread the disease. So it is called as spreading factor. This is how the disease progress very fast. Local exotoxins, necrotoxins produce local effect. Toxin causes excessive inflammation. There is swelling. Swelling is hot, highly painful on palpation, and swelling is initially red. There is extensive edema, progress to necrosis of the muscle, followed by production of gas, emphysema, and finally gangrene of subcutaneous tissue and muscles. So disease is known as gas gangrene or myonecrosis. The local toxin is also absorbed into the blood, produce a serious condition, toxemia, and results death immediately. Friends, we have discussed here important predisposing factors and pathogenesis of malignant edema. For watching more video on disease of veterinary medicine, watch youtube.com/Dr. Wayne. Requested to share the information to veterinary friends and veterinary students. Press like button, subscribe to promote the channel. Thank you very much for observing this video.